Along the path to reopening, health officials say we need systems in place to contain future outbreaks. That means states and cities will need to invest heavily in contact tracing.
Contact tracing has been a strategy used for, as I already mentioned, decades to deal with syphilis, gonorrhea, chlamydia, and to some extent HIV.
Dr. David Harvey is the head of the National Coalition of STD Directors. He says health department officials called contact tracers were most recently successfully used during an HIV outbreak in Indiana back in 2013, when, interestingly enough, Vice President Mike Pence was governor.
They got on top of the outbreak, they navigated people to testing and services, and they ultimately contained that outbreak.
So here's how it works. You've been out in public and you've tested positive for the virus. Contact tracers will track down everyone you came into contact with, tell them, test them, and then quarantine them, and then do that for everyone they came into contact with. I know you're thinking, that sounds much easier to do in the case of a sexually transmitted disease, not one where you contract it by just breathing the air.
Yeah, so contact tracing for STDs versus a respiratory illness like COVID is a little bit different, but there is a similar set of skills required.
There are a number of ways to go about it. Google and Apple have teamed up to take the technological approach, with both developing apps to track people who have had the virus. But for the other tried and true method, Harvey says we need to hire more contact tracers. And nationally, medical experts say we need a small army of roughly between 100 and 300,000 people to do the job.
And DC is very busy planning for this.
Mayor Bowser has launched a contact tracing force. They're looking to hire a team of 200 contact tracers right away. And when we get to phase 1 of reopening, the city wants to have an additional 700.
These are proven strategies that have been employed throughout the years. And this workforce has existed for a long time.
In Northwest, I'm Matt Gregory, WUSA 9.